Ladies and gentlemen, we're going to wait just a few minutes for our keynote speaker. So if you can please keep talking, get a cup of coffee if you like. We're going to pause just for a few minutes. Thank you.
I'm coming to hug you.
Okay, ladies and gentlemen, can I ask you to take your seats, please? Ladies and gentlemen, welcome to the first Armed Services YMCA Congressional Panel on military child care for military families. My name is Charlie Williams, and I'm the Chief Operating Officer for Armed Services YMCA. We're very honored to be with you here today and really appreciate everybody attending. And before we begin, I would like to make sure everybody knows that we are live streaming the event. And if you could please silence your cell phones, I'd appreciate it very much. I want to begin this morning by introducing the President and CEO of Armed Services YMCA, Vice Admiral Retired Bill French. Bill served for 36 years in the Navy as a nuclear submarine officer and commanded at multiple levels, including command as commander of Navy Installations Command, where he was responsible for worldwide Navy child care and other youth programs. Admiral French joined Armed Services YMCA in 2015. Ladies and gentlemen, Armed Services YMCA President and CEO, Bill French.
Good morning. Good morning. Thank you all for coming, and thanks everybody that's watching this virtually. I appreciate everybody's interest on this critical topic we're going to discuss today. Special thanks to Congresswoman Speer and her fellow House and Senate congressional leaders and their staffs for continued policy and appropriations supporting our military families. Thanks to the White House and the Joining Forces team for being here. Also to our sponsors for child care, USAA, General Motors, and Lockheed Martin for what they've done to support us providing child care to military families. I'd also like to recognize several military support organizations that also do their part in supporting military families. With us today are representatives from the American Legion Auxiliary, Blue Star Families, Easter Seals, the Elizabeth Dole Foundation, Military Child Education Coalition, the Military Family Advisory Network, Military Officers Association of America, United Through Reading, and the Wounded Warrior Project. And other organizations, including the YMCA of the USA and IAC, who is the parent company of Care.com. Our Services YMCA Board Chair, retired Vice Admiral John Byrd, and many board members from the National Board of the Armed Services YMCA. Today, the Armed Services YMCA runs programs to support military families at 87 DoD installations. These programs and services are provided in alignment with the leadership at those bases and installations to help meet military family needs. A little bit about my background. I think Charlie did a nice job of highlighting kind of what I did in the last part of my career, but my wife Monica is here with me. Hey, honey. This morning, and I spent nearly 36 years serving in the Navy. It became evident very early on in our career how important military families are to the operational readiness of our forces. And service members need to know their families are cared for in order to perform at their best. And frankly, affordable and quality child care is the critical element in ensuring the well-being of our military families. Military family comes in several forms these days. Those with military members and civilian spouses, those with dual military members, and many single-parent families, all of which have one common interest, and that is they need quality and affordable child care. This morning we have the great pleasure to be joined by one of the strongest champions of military families in Congress, Representative Jackie Speer. She was first elected to Congress in 2008, and she represents California's 14th Congressional District. As chair of the House Armed Services Subcommittee on Military Personnel, Congresswoman Speer is steadfastly committed to supporting our veterans, military service members, and their families. Earlier this year, Chair Speer joined several of her colleagues on both sides of the aisle to introduce legislation that seeks to confront the child care crisis facing military families today. This bill Military Child Care Expansion Act would equip the Pentagon with new tools to address this urgent situation. Armed Services YMCA strongly supports this legislation and applauds Chair Speer and her colleagues in both the House and Senate for leading the charge on this important issue. Furthermore, we thank Congresswoman for taking the time to speak to us this morning and stand ready to assist her and her fellow congressional champions as we confront this operational readiness issue. Please join me now in welcoming Congresswoman Jackie Speer.
Thank you, Vice Admiral Retired, for your introductory comments and most importantly for your service as well as your wife's service to our country. I'm really honored and delighted to be with you, and I want to thank the Armed Forces YMCA for this opportunity. I wish this room was twice as full because that's what it's going to take. I also want to introduce and thank publicly my staff, military liaison director, who is responsible for all the great work we did on child care this year. Brian Collins. Brian, where are you? There he is. So I came to the Armed Services Committee from what's called a JUICE committee. It was the Financial Services Committee. And JUICE committee in Congress means you can raise a lot of money. So why would I leave a JUICE committee to come to the Armed Services Committee? And when I asked the speaker for the change, she says, "Are you sure you want to do this?" I said, "I'm absolutely certain I want to do this." And it was because at the time, and this was some 10 years ago, I was focused on the issue of military sexual assault. And I realized that there was no way I was going to fix that unless I was on the committee. So then I put my eyes on getting on the Military Personnel Subcommittee, and then eventually getting to the position of being chair. So this has been a long time in coming, but it was a very direct path in doing what I felt needed to be done. And I made my motto and my mission on becoming chair of this committee to recognize that when the service member serves, so does his or her family. And that is something I repeat at almost every single hearing we have. So we have focused in on child care in particular because we have a huge problem. And you're part of the solution. So I'm here as much to give you a pep talk to convince my colleagues on the Senate side that what we have in the House bill has to stay in. Now, as you look at this issue, it's not uncommon for the entire country. Half of the country lives in what we would call a child care desert. I'm also one of the co-chairs of the Democratic Women's Caucus, and we have made crystal clear that in part of this Build Back Better plan, you cannot just have an infrastructure bill that's going to generate 2 million jobs in infrastructure over the next 10 years, 90% of which those jobs are going to go to men, and not deal with the fact that 1.5 million women have left the workforce since COVID, taking us back to labor participation rates that are 1988. And they have left the workforce in part because of child care needs. So we've got a country that does not have the infrastructure for child care for everybody, and we certainly don't have it in the military. So what's the challenge and what do we have to do about it? We have long wait lists at our bases, some that are in fact 9,000 families long. That's a disgrace. How can you say that you're putting your service member first if you're not going to put them and their families first? And so it's become, I think, a very important focal point for us. In the service, you don't have a 9-to-5 schedule either. So we've got to have a child care network that recognizes that in many cases it's a 24-hour operation. Last year, or earlier this year has been so long, I was at one of my number of visits to Fort Hood. And whenever I go to a base, and I go to bases around the country and around the world, I ask to speak with families. It's where I get some of my best information. The spouses are not afraid to speak up. But in this case, I was meeting with enlisted service members. And one service member raised her hand and she said, "I'm a single mother." So think about it. This is a military service member, single mother with a small child. She has to be at PT at 5:30 in the morning, and the child care center doesn't open until 5:45. So those are kind of blind spots that we have that we've got to fix. So I went to the general and said, you got to fix this. Some of these things are so obvious, and yet there's blind spots that we carry around with us. Well, you don't have the blind spots, and that's why it's important for you to speak out to the committees and tell them what you're seeing on the ground. The Defense Department in 2020 released a report that said that nearly 9,000 families had an unmet immediate need for child care. That's 9,000 families with spouses who either have to change their work situation or end up not being able to work. Now, one of the great awakenings for me at the very first base that I went to is we do not have stay-at-home parents in the military anymore. We've got to recognize that. They have professions. They are highly educated. They have licenses. And that's one of the reasons why we have made it so there's reciprocity now when you PCS from one location to another, that you don't have to go through that process of trying to get recertified in another state. So it's very important that we do something about this, not just talk about it. The longest wait lists for military child development centers are in regions that have, as you would expect, overwhelming utilization. They are oversubscribed. So even with a robust fee system, our families can't get into these child care centers. So what are we doing about it? Well, first of all, think about this. There are 135 child care centers at bases that are deemed to be failing or in poor condition. You would think, well, how do you define failing and poor? Are we talking about asbestos and lead and mold? What are we talking about? And despite the fact that there's clear demand, and they've already identified 135 of these child care centers that are poor or failing, what is even more shocking is that in their budget requests, the department did the following. For the Air Force, only one child care center was slated for military construction. In fact, the Army and the Air Force included 6 additional projects in what they called a priority on their unfunded priority list. Since when are children and families unfunded priorities? And what does that say about our value system? What does that say about our commitment to our service members and their families? Now, while the Air Force and the Army suggested 6 for their unfunded priority list, the Navy was worse. Excuse me, Admiral, but that's the case. The Navy didn't put any child care centers in their military construction project and put nothing in their unfunded priority lists, even though they have 21 centers that are in need of renovation and or replacement. And despite operating in 4 of the 5 geographic locations with the worst wait lists. So, what are we doing about it? Well, first of all, I want to put a shout out to the chair of the Military Construction VA Appropriations Subcommittee, Debbie Wasserman Schultz, who recognized that we had to do something and was responsible for making sure that we got those 6 unfunded priority projects into the budget. But that is not enough. So I've done the following. I fought to increase the fee assistance caps in high-cost areas. We've got to recognize that child care costs differ. Now, you will be stunned to know that in my district in California, for one child, for one infant, to be in child care, it is $2,300 a month. That is more than many people's mortgages. It is more than in-state tuition in many states for college. So that's really important, to increase the cap. I'm also requiring in the House version of the bill to demand that we provide after-hour child care for service members who work night shifts and different schedules. We did establish last year, through an amendment I got into the bill, a pilot program to pay for in-home child care, such as hiring a babysitter at the 5 worst locations in the country, which include, in terms of wait lists, San Diego, San Antonio, Hawaii, Norfolk, and the National Capital Region. In-home child care can address the lack of capacity in many areas. And so this year in the NDAA, I have language in there that takes the pilot universal. So that means that families are going to be able to find child care solutions conceivably in their own homes. Further, we have demanded in the NDAA that the services develop a plan to renovate these 135 child care centers that are poor and failing, and that they do that in 10 years in terms of the military construction plan. I'm also requesting that the DoD come back within the next 3 or 4 months and give us an idea of what the wait lists are at each of our bases and what they plan to do about it. So, the rest of the year I'm fighting to make sure all of this stays in the bill, and that's where you come in. Please convey to our colleagues on the Senate side how critical this is to the service members who serve our country. How important it is, as Vice Admiral said, to readiness. How important it is to retain those who serve. You know, one of the things we're all waking up to as a result of COVID is that the work environment, the working conditions in this country have to change. That employees are speaking up. There's now a whole concept in the corporate sector about war on work, that somehow people are just resigning because they no longer want to work a 5-day in-person work week and have a 2-hour commute when they can establish that they can work from home and have equal or higher productivity. So while that's happening in the private corporate sector, we need to look at what we need to do in the military to make sure we can retain the talent that we've acquired and retain the talent that we've trained, because we know how costly it is to retrain others. So I'm excited that you're here. I'm excited that you recognize this need, but I implore you, be multiple voices that speak to the Senate about the need to keep all of these provisions in the legislation. Thank you.
Congresswoman Speer, thank you for those remarks and for joining us this morning. We look forward to working with you and your team to ensure that this topic remains a priority both on and off Capitol Hill. As we shift to the panelist portion of the program, I want to first call your attention to the slide behind me, either side. This slide is also in the handout that you received this morning. Armed Services YMCA hosted 6 focus groups with military spouses and members during the months of August and September of this year. At each location, spouses consistently spoke about the factors that make military life especially challenging today. Those challenges are listed on the periphery of the slide that you see. Long hours, unpredictable schedules, spouse employment, frequent moves, deployment and training. And the resultant stress and isolation factors are in the middle. The lack of access to affordable, quality childcare exacerbates each of these factors at every pay grade, but especially in our junior ranks. We heard that message from every spouse in our focus groups, and we're here to discuss this challenge this morning. With that, I want to introduce our esteemed moderator, former Congressman Henry Bonilla. As many of you know, Henry represented his great state of Texas in the House for 7 terms from 1993 to 2007. During his tenure, Henry was chosen to serve on the House Appropriations Committee in his first term, a position not held by a freshman in more than 25 years. He quickly moved up the committee ranks, serving as the chairman of the Subcommittee on Agriculture and as a senior member of the Subcommittee on Defense. After leaving Congress, Henry joined the Normandy group, where he has served for 14 years. Still a resident of his hometown of San Antonio, I hear it's known as Military City, USA. Henry knows firsthand the importance of adequate child care services to our servicemen and women. Henry, thank you for your leadership on these issues and for your partnership with Armed Services YMCA.
Charlie and Admiral French, what the Armed Services YMCA has done to draw attention to this critical need is incredibly impactful, and I think it says a lot that we have a very nice turnout here today, that we have a great leader in Congress today joining us for a few minutes this morning, Congresswoman Jackie Speer, and to have her out there advocating for this incredible cause is a big deal. So thank all of you for being here today, and anyone who wants more information on the Armed Services YMCA, easy to find at asymca.org. And they have a lot of detailed information and also can give you an opportunity to participate with this great group if you'd like. As Charlie mentioned, and he put the graphic up a minute ago, military families deal with so many challenges. And it is, as Jackie Speer said, when one is serving, especially as an enlisted member, the separation, the frequent moves, the isolation, the increased need now for child care are incredible challenges. 7 out of 10 now military families face the challenge of child care. We have a great panel here this morning that's going to address this further. I will introduce them individually in just a moment, but the 4 of them are Besa Pinchotti with the National Military Family Association. We have also Lynette Fraga with the CEO of Child Care Aware of America, and Tim Allen, who I already asked him if he's also funny, but he's the CEO of care.com. So we will begin with Besa Pinchotti, and I know she has a lot to add about the impact of the lack of child care on enlisted personnel, and how of all things now people are understanding that actually affects readiness. So without further ado, I'll turn it over to you, and for each panel member, we remind them that they have 5 minutes each, and then we're going to have time for questions and discussion at the end. So Besa.
All right, thanks so much. Childcare is an issue for all Americans, right? It's not unique to military families, but the lifestyle that our military families lead makes those challenges much more difficult. So moving every 2 to 3 years, leaving your community, dealing with deployments, all of these things are just part of military life. At NMFA, we've been advocating for better access to quality childcare since the 80s, when my own parents were probably looking for childcare for me, right? So this has been going on a really, really long time, and we're still talking about it because the issue still is not solved. Childcare is a military family issue. It affects readiness, recruitment, retention, financial stability, and well-being for the entire military family, because as we've already mentioned a couple of times, when a service member serves, that entire family serves right along with them. And there's nothing more than the health and safety of our children. How can someone be ready to serve when their family isn't taken care of? There have been a lot of conversations about childcare over the years that have focused on women, because in a lot of homes, women bear the brunt of that. More than 90% of military spouses are women, and we often think of it as an issue that prevents a military spouse from having a career. Yes, it does. But in the United States today, families are dual income families. And it's not just about a military spouse wanting to fulfill her career dreams. It's about financial stability. It's about taking care of the family. And when you're struggling to access childcare, you can't look for a job, and then you can't go to work. So how do you do those things? In fact, a lot of military families make the decision to leave the military because of these very issues. In 2021, if you have two parents and you have kids, you generally have two incomes, right? Or at least you have the need for that. And so you're moving on a regular basis and you don't have the access to the reliable childcare. And it's expensive when you find it. It's not ideal. One of my colleagues here today, Nicole Russell, she's an active duty military spouse. She has a 6-month-old baby. She's been on waiting lists for 9 and 10 months. This morning she had a child care emergency, and she was lucky because her service member was home today and he was able to watch baby Atlas. But that's not generally the case. That's not how it normally works for a lot of military families, because the service member is required to be there, and there is often not at home. So we also just spoke to a military spouse in Florida who, after 2 years, finally found great care for their child who had special needs, and now it's time to move again. So the conversation that they're having is, do I stay in Florida with my child in this wonderful care that we finally found for them, or do we pick up and move and start this process all over again? Financial security is a huge part of military family well-being, and childcare is a big part of that. We know military families are having a tough time financially, and we know that because we see how things are playing out in food pantries. If we look directly at food insecurity, we asked 11,000 families, E1 to E6, whether or not they visited a food pantry in the past year, and 14% of them said yes. So we're not talking about families saying, ooh, can we squeeze by until the next paycheck? We're talking about families who didn't have enough to squeeze by to that next paycheck, and they're visiting food pantries, and they're cutting out things that most families have, the comforts of being a family and living in this country that their service makes available to all of us. And it's not just the parents who are struggling in this way. We recently surveyed military teens, and we asked military teens, are you worried about food insecurity? And 36% of them said that they're worried or have worried over the past year whether their family would run out of food before they had money to buy more. So financial security is a huge problem, and childcare is just a part of that puzzle. We've all been doing things to work on this issue. Everyone up here on the stage with me, a lot of the wonderful organizations in this room have been doing a piece of the puzzle. In 2020, after the pandemic took families through the ringer, National Military Family Association stood up a child care fee relief program. We had some wonderful partners that helped us do it. We, by the end of this year, will have given out $5.7 million in child care fee relief, supporting 3,400 military families with their child care needs. And that is such a drop in the bucket. We're helping them this much, but the problem is so big and it's really complicated. And I really look forward to working with all of you and all of us working together, because our military family readiness and stability depends on it.
Thank you, Besa. There are a lot of staff members here from congressional offices, and for those of you who have not had a lot of experience on Capitol Hill, staff drives the train in many offices. And we are grateful for so many of you participating here today, and we certainly hope that you take the strong message back to your bosses about the need to address this issue. I'm not aware that there has ever been a panel discussion with great leadership like this on military child care ever on Capitol Hill. So this is a first, and we are again thankful for the panelists who have joined us here this morning. And now Lynette Fraga with the Child Care Aware of America organization is going to tell us how the overall need for child care in the country ties in with what military enlisted personnel need.
Thank you so much, and good morning, everyone. It's wonderful to see you in person. First, let me just say thank you to Admiral French and Admiral Williams and Greg Young for the invitation to participate with you today on my most important and favorite subject of all time, child care, and particularly with the community who cares so much about military families, because I am a military kid, and I worked for the military as well. And military child care. So this is not only a professional point of passion, but it's also a personal point of passion, notwithstanding the fact that I also have 2 children. And the child care story was also my story as well. So thank you for the opportunity to participate with you today. Service to community with excellence. It's really the most resonant phrase that comes to mind as I share my appreciation for the experiences of learning from and growing with and passion for our military children and their families. Again, I've had the opportunity to serve in multiple roles with the military child care system, which really revealed to me the art of the possible for children in the United States and around the world in child care programs in multiple settings. Child Care Aware of America, of which I am the CEO, is a national membership organization that works with child care resource and referral agencies all across the United States, whose mission it is to do just that. Make sure that each and every child in the United States has access to quality, affordable care. And we have not reached that goal yet. You've heard this morning the challenges of identifying and finding child care. And we continue to try and figure out, how do we do that for all of our nation's children and families? We at our organization lead projects, many times in partnership with those at this table and in the room, to try and make sure we're amplifying the fact that each and every day we have families who can't make it to work. We have children who may not be in safe settings. We have families who are worried about where their children are and if they're learning and growing and thriving like each and every parent wants their child to do. And I've been asked today to almost do the impossible in probably now 3 minutes or less. And that is to describe the child care landscape in the United States. I think our prior 2 individuals with Congresswoman Speer and my colleague to my left, we have already shared a lot of the challenges that each and every one of us know is real. Now it's time for action. We know what children need, and we know what families need. We need to make sure that they get it. Before the pandemic, in the United States, childcare was already fragmented. This is not a new issue. Now we're at the breaking point. That is where we are today. It's underfunded, and the public invests only about $1,500 per child annually in care and education in children's first 5 years in life, and then invests almost $13,000 per year annually for the next 13 years. That seems problematic, given what we know about the science of early childhood development. Learning begins from birth, and the first 5 years are the most critically important for brain development. So why is it that we're not investing in those first years when parents and children most need us to support them? The child care system relies on a patchwork of funding streams that places too high of a burden on families paying the price of care, and on educators, who we cannot forget are the drivers of quality. With a median pay of only $12 per hour, often without health insurance or other kinds of benefits, clearly inequitable. And the problem we have today, if I were to name one of many of the complexity of the challenges that we face, there are not enough child care providers to meet the demand. We do not have our providers out there in the field. They're leaving the field in record numbers, even before the pandemic. And this particularly affects families of color, families living in rural areas, and children with special needs. Prior to the pandemic, the child care supply was decreasing, and over half of the U.S. population lived in child care deserts. Congresswoman Speer spoke to those deserts. When COVID was layered onto an already fragile child care system, it shattered. From December 2019 to March 2021, our surveys of CCR&Rs and other state partners found a total of 8,900 child care centers closed in 37 states. 8,900. Imagine the number of children that were not served as a result of those closures. 7,000 family child care programs closed in 36 states. And there's one final issue before I promise I will turn it over. Quality matters. I guarantee you that each and every family who's looking for child care wants to ensure that their child is in a situation where their child is thriving and nurtured and cared for and loved. Anytime I've had a conversation with a parent, they say, I just want to ensure that my child is loved when I go off to work. It is not enough to simply count the number of licensed childcare slots in a community. The number of slots in high-quality settings is equally, if not more important. There's so much more to say, but I will say this. I'm always, always thrilled to speak about the promise of child care and the opportunities care can offer for children and families. Now, we are finally at a moment where promise could be realized and children, each and every child, could thrive. We need to focus on that and ensure that we're addressing all of the significant challenges that we are seeing in our nation as it relates to child care. Thank you.
To all of the congressional staff here in person today and to those watching on C-SPAN, please know that all of the panelists here today are available beyond today as well if you need further information. And if you need to, you can go through us at the Armed Services YMCA as well. And Admiral French, you're next. You're the leader. Without your leadership, we wouldn't have this great gathering here this morning. And I've gotten to know you over the last year and a half or so, and to hear you speak about this issue, not just on the statistics and the different needs and installations around the country, but the passion that you have for this issue and others for enlisted personnel is unparalleled. So we're delighted to hear from you this morning about how this all came together and what else we need to do.
Congressman, thank you very much. Thanks for being here. I've always been passionate about child care, but I will tell you about 11 months ago, I got even more passionate when I became a grandfather for the first time. And so now all of a sudden you ask a lot harder questions, right? It's amazing how much more interested you are at times about your grandkids than you are your kids. I'm going to take a little bit of a different approach. First of all, it's difficult to follow the two folks that preceded me. You can't find two more passionate people making a difference in how we approach military child care. But I want to talk a little bit about DoD child care. I think somebody mentioned the last 3 years of my career, I was lucky enough to be responsible for overseeing the child and youth programs for the Navy. There's lots of goodness here. I will tell you, the military, DoD, is the largest single employer provider of child care. They do a very good job of providing quality child care. I used to call it the gold standard. It really is quality child care. They do other things. They have really well developed curriculum that they provide at no charge to anybody who wants to use it. They have great work with compacts with organizations like Military Child Education Coalition. They've made great advances to support military families and other families that move from state to state. They also have great programs when it comes to spouse employment. But I think the real challenge today, as Congressman Speer identified, is there are deserts or there's locations where there's a significant shortfall of child care. She mentioned, I think, the big ones, San Diego, the DC area, Hampton Roads, Hawaii, Seattle area, and I think to a lesser extent, San Antonio. Those are the areas we have to come up with a solution. I would tell you, I think the solution may lie with MSOs, military support organizations, and nonprofits that have the capacity to provide the child care in those locations where there is not enough military child development centers, home sites, whatever it is, drop-off care, after-school care, that we need to be able to figure out how to plug in and provide the same quality child care for those military families, but delivered from a nonprofit. I think that's the way ahead. The DOD has been wonderful to work with. They understand there's value that nonprofits can provide to them. They'll share all their coursework. They'll do whatever we can, but I think in the end, what we want to have is a system with DOD standards and such that to Lynette's point earlier, you are confident as a parent that when you put your child into child care, it's going to be taken care of. The people there are going to love them. We need to make sure that we can coordinate, work with DOD, and I guarantee you DOD is very interested, particularly in those locations where there's a shortfall, to work with organizations like ours. I will tell you that COVID only made this whole challenge that much harder. We had some opportunities during COVID. In fact, we run about 14 different locations. We run drop-off care. We, the Armed Services, the YMCA, drop-off care at military treatment facilities or hospitals. And it's free drop-off care for folks who can go to the hospital, get whatever is done either for themselves or for another child. They can drop their kids off. The commanding officer of a hospital in Texas came to us and said, hey, during COVID, we really need you to change your approach a bit and not do drop-off care for patients. We need you to do full-time care. We'll even give you more space to take care of our employees, the ones providing the medical support to folks. So that's the type of flexibility I think we need to have, talking closely to DOD to understand what their needs are, and then we've got to have the support necessary to go do that. During COVID, we had CARES Act funding. We used the PPP funds to go continue to pay folks to go do that mission, pay folks to be able to go support those kids. But as COVID goes away, which is a blessing for our country, we're going to need to figure out some other way to supplement our funding to be able to continue to provide that type of care. We're very lucky to have organizations like I mentioned before, like General Motors, USAA, that provide funding to us, but it's not going to be enough in order for us to make a dent in what is about a 9,000 child shortfall when it comes to military requirements. We need to partner with DOD. I think it's an opportunity for nonprofits, particularly MSOs, to make a difference and try to address this problem in a constructive way. So thanks for being here, and I think there's really an opportunity for us to make a difference, to make life better for our families. Thanks.
Thank you, Admiral. And as a fellow grandparent, I know what you've gone through. I've got 4, and there's something about the magic it brings to your life. So thank you for that. And I also want to point out, unrelated to what we're discussing here this morning, I'll never forget the Admiral reviewing last year during COVID the incredible need for food, and the donations that Armed Services YMCA gathered around the country at installations to help military personnel is something that those families, what an impact it had just to keep them going. So aside from childcare, that was an incredible accomplishment that the organization was involved in during the COVID. And now we're going to have the person whose name you'll remember most after this event because he can identify with the famous comedian Tim Allen, but as already mentioned, he said he's not as funny as Tim Allen. But Tim, you're a fellow Texan, you came in from Austin. And the CEO of Care.com is now going to tell us about the overall impact of what his organization is doing for childcare and how it ties into what we're doing here today. Tim.
Thank you so much. And also thank you, Admiral French, and thank you to Armed Services YMCA for having us. I think this panel is so important to have this conversation, and it's not a conversation that's had enough. You've heard a lot of information, a lot of data. We're also sharing a lot of information as well. You know, as I go through this panel, the conversation that I think is so pertinent to what we're talking about is in two pillars. And those two pillars exist in affordability and accessibility. And it's not only affordability for the families, it's affordability for the centers to operate as well. Right? They've taken on more cost, they've taken on more responsibility with COVID, they've taken on more in terms of labor pool, right? It is a very active labor pool, as we've discussed previously, for all of the childcare providers out there. It's important for us to have wages that are actually going to be able to provide that high quality care, but also to be able to be open and expansive in this era. If you look across the landscape, as we have, and Care.com keeps track and does a lot of panels and a lot of surveys, we're keeping tabs on what's going on with the families. You know, over 85% of families say they spend at least 10% of their not even disposable, their income on child care. And we talk to military families, that rises to 95% plus. 95% of military families are spending over 10% of their income on child care alone. And if you look through the remaining data, over half of those families are saying it is more difficult now than pre-pandemic to find childcare. And that's a problem, because pre-pandemic, it was pretty hard to find childcare. We've talked a lot about childcare deserts on this panel. My esteemed colleagues have come in and said, you know, what's going on in childcare deserts? They were real. They were real in a lot of rural locations, but they're also real where a lot of military installations exist, as evidenced by the wait list that we've been talking about, over 9,000 children waiting to get into a military facility for childcare. It's a real problem in terms of access. And for us to be able to solve that problem over time, I think it's going to be a really interesting intersection of both government and nonprofit with private corporations. We actually facilitate the matching and we facilitate the needs-based assessment for families to determine what kind of care they would need. Over at Care.com, what we do is we work with organizations such as the Armed Services YMCA. We have a deep partnership. I'm actually the proud product of a military family. I was raised in Ramstein on the Air Force Base. My mother was a nurse at the Armed Services Hospital. So you're talking to someone who not only is proud of the military and has a passion behind it, but is a product of that. I was a child raised on a military facility. I know exactly what happens. I know exactly what it takes for a community to come together and raise a child. I will say it went well sometimes. I'm not the best child, but I will tell you that. But I will also say, though, that my mother had to negotiate with neighbors and had to work with the military installation in terms of what kind of babysitting was available, because there wasn't a DoD-sponsored childcare center on Ramstein at the time when I was growing up. So we really do put our military families under an undue duress by having this exist. Now, as I mentioned before, the inflection of private and nonprofit and also DoD-sponsored facilities, I think, is going to be the long-term solution. It's also going to take what I call a reimagination. The actual 1960s format of childcare is no longer applicable in today's environment. There's a flexible work environment happening in the private sector, and the military is not far behind. Parents need flexibility in their schedule. They need the ability to have drop-off care on their schedule, not on the schedule of the facility itself. They need to be able to have in-home care that actually works and caters to their needs. What we say at Care.com is it's the family that matters. It's the family at the center. So it's the family's needs that we need to organize around, not the actual in-home provider or the facilities. We want to take care of our facilities and our providers, but we want to make sure the family's needs are met first. So what that will take is we are staunch advocates for the Military Child Care Expansion Act. We believe more funding in the DoD. We believe more funding for child care should exist. We're staunch advocates for all of the Build Back Better program in terms of child care. We don't think that that should be left on the floor. We at Care.com believe better funding, better government support, better programs, plus corporations stepping in to support nonprofits such as the Armed Services YMCA are the way to the future. Because what ends up happening is the children are the ones who are impacted the most. One of my fellow panelists mentioned the developmental years of 1 to 5 are the most important. There's numerous studies that show the crime rate goes down for children who actually receive quality care. They have better test scores. They perform better. They actually go to college and actually become productive members of society. It is actually societally beneficial to us to invest in our children from 1 to 5 because the ROI is for $1.20 versus 87 cents for kids who actually get quality care in the first 5 years. I hate putting numbers on children, but a lot of you are math people, so I know that I have to do it. So I understand what happens inside of this structure in this program. I'd also just kind of close out with this. At the end of the day, when you look at affordability and accessibility, it's pertinent for us to be able to put effective programs in place that matter. It's not just the table dressing anymore. It's not just checking the box. It's not using our public school system as a daycare, right? Because public school systems still work in the agricultural sector of a 8 a.m. to 3 p.m. I don't know about you, but many parents I speak to don't end their workday at 3 p.m. They actually also are working at night. Now, as we're tethered to computers and to our phones and to our lifestyle, they're working all the time. And parents need relief. And that relief comes in providing a backbone of care and an infrastructure of care. If there is not that backbone of care, the economy doesn't work, our military doesn't work, our structure and our society doesn't work. It's the most important investment that we can make today for our future. So thank you so much for having me. Appreciate it.
There are so many partisan issues here in Washington, unfortunately, that we see on the news every day. This is a bipartisan issue, strong bipartisan issue. So again, we just can't thank the panelists enough for being here today. If there are any questions, we have a couple of minutes left. We want to respect everyone's schedule here today. Are there any questions from the audience? And if not, just remember that these good people are available well beyond today's event. Thank you all for being here. With that, I'll turn it back over to COO, YMCA COO, Charlie Williams.
Well, thank you very much, Henry, and thank you to each of you here today. Thank you to the panel members. Your incredible leadership in serving our military families is absolutely instrumental to helping solve this challenge of child care for our military families. On behalf of Admiral French, I do want to reaffirm Armed Services YMCA's commitment to be a leader, an integrator, and a collaborator on this critical issue. I also want to announce that Armed Services YMCA will lead a convening of a National Military Child Care Partnership Council, which will be focused on developing public and private partnerships to address military child care shortfalls. I look forward to working with the organizations that are already on this, and I know that we must all work together if we are to solve the child care challenge and truly strengthen our military families. Thank you again to Congresswoman Speer, the Joining Forces team, our esteemed panelists, and to all of you for attending. Thank you.